Welcome back, everybody. This is John Malanca with the Association of Cannabinoid Specialists with my colleagues, Dr. Jordan Tishler and Dr. Adam Abodeely. How are you guys doing?
Great, thank you.
Good to see you guys as always. So today's topic comes up quite a bit in not only in the medical world, but also in the cannabis world. It's called CHS, Cannabis Hyperemesis Syndrome. It's a condition caused by long-term cannabis use. And so a lot of patients, when they think that cannabis is always safe and friendly, you can overdo it, just like alcohol, food, opioids, and drugs. And so generally what happens is nausea, throwing up, dehydration, confusion, and a lot of times people unfortunately think they're dying and call 911. So if you both would like to add to this, is this something that you see in your practices, and how do you treat this? Dr. Tishler, why don't you start it off?
Thank you. I've definitely seen this and was sort of amongst the first to report about it. I remember giving a grand rounds on this topic in 2013, 14, something like that. As I was saying to you guys earlier, it's not something that I find particularly concerning or moving. You're right, absolutely, that we see this in long-term users, particularly heavy, high-dose users. So, use of concentrates it has accelerated this a little bit. Thankfully, however, the incidence of it is still relatively low. And there are a whole bunch of other non-cannabis related vomiting illnesses that Dr. Abodeely can speak to, I'm sure, that are often conflated with this. And amongst my ED compatriots, ER doctors, I should say, there's a certain annoyance level that we're seeing come out about when patients end up in their emergency room related to cannabis. And that's, I think, a fair bit of stigma attached to that's just unnecessary. And if somebody comes in with a nausea and vomiting type illness and admits that they use cannabis, unfortunately, oftentimes what we see is these two things get put together and that diagnosis gets made when it's probably not really appropriate. Lots of people get nausea and vomiting and also use cannabis who don't have CHS. So, there's a little sort of holier than thou thing that's going on there that I think is inappropriate and really quite unbecoming of my physician colleagues.
To clarify, excuse me, Adam, 1 second here. Are you only seeing it with THC, the cannabinoid THC, or are you seeing it with other cannabinoids? So basically, it's a high doses, long use of THC, which people are having these effects. And how long does it usually, how long does the syndrome take to go away? And if you want to add to that, Adam.
Like Dr. Tishler, I agree that I think there's been a lot of excessive hype about cannabis hyperemesis syndrome. A lot of it does probably have to do with the continued stigma that's associated with it, particularly for those who are biased against it. And I think I have a quite unique perspective, and it's been really overemphasized since cannabis has started to become, more accessible. And I'm my specialty, as you know, is in GI. And so, I not only do surgical GI, but I also do medical GI. And, to Dr. Tishler's point, I've had to, educate our ER providers about this condition because especially being a GI person and especially doing medical cannabis, anybody that has any of those two things gets sent to my office. And I'll show up and they'll show up in my office for follow-up, and they say they're here because, they told me I have cannabis hyperemesis syndrome, but I don't think that's it. And so I say, okay, well, tell me more. And then you start to really nail down a history of whether or not this could be cannabis hyperemesis syndrome. And, maybe sometimes the physicians or the providers in the ER get it right, but a lot of times they've misdiagnosed it. And we do have to be extremely, we have to be mindful of it because it is something that should be on the differential of somebody who comes into the emergency room having nausea. But the symptoms of, there has certainly been a knee-jerk reflex that if somebody comes into the emergency room with nausea and vomiting and they've got cannabis on their on their list of something they consume, then that oftentimes people will jump to that diagnosis inappropriately when, there's so many things that cause nausea, right? Anything from, gastroenteritis to gastritis to gallbladder problems to reflux disease to cyclical vomiting syndrome. The list goes on. And so, missing something like gallbladder disease is real, which I've seen happen more than one occasion.
Unacceptable.
It's unacceptable, right? And where missing cannabis hyperemesis syndrome, you're not necessarily, you're not likely to cause that person a lot of harm. You just made a wrong diagnosis, and they'll be back when they consume cannabis again. So there has been a huge educational component to this, and I, fortunately, we have gotten a lot better here locally and regionally at understanding this diagnosis. But there is no doubt, I'm going back here about 3-4 years ago when I was getting calls from the emergency room all the time, for somebody with cannabis hyperemesis syndrome. And, or the providers would call. And of course, some of these providers were those who were not in favor of cannabis. And so the herein goes, the battle of us trying to validate this as a medicine. But it exists. And I think that we just need to be better about how we train people on this being one of the many reasons that people could have nausea or vomiting.
How long will it take for vomiting or nausea to subside? Is it about 24 to 48 hours? Is it right away once they kind of let the cannabis wear off? What have you seen in your practices? And again, if they want to, and I hate the word cure in anything, but if they want to recover, I should say, how long does that generally range? Is it days to weeks to months before it's completely out of the system? Is that what they're trying to do, is flush it out of the system and don't go back to that? Is that something that they can reverse, patients can reverse?
So you sort of asked two questions there. One was, how long after they stop using cannabis will they feel better, right? And that's a little bit variable, but sort of in that 24 to 48 hour period of time, generally speaking. The second question you asked, which I think is almost more interesting and problematic, is, okay, then how long do they need to abstain before they can go back to using cannabis? And unfortunately, there are a few people who seem to be able to go back, but most people, once they restart cannabis, they're right back where they started.
Which I have seen that as well. One thing that a lot of the doctors that I've worked with in the past have recommended for patients that are going through something like this, and maybe if you agree or disagree, taking a hot bath, taking a warm shower, is that something that you would recommend, or would you recommend a patient taking themselves to the hospital or calling 911?
Well, I don't know if I would recommend it as much as it really helps with the diagnosis more than anything else. I have seen a couple. There are people who are, they come into my practice. I'm like, this might be it. And so one of the ways that we can determine it, because a lot of people aren't excited about having to stop cannabis, especially if they've got GI problems and they think it helps for something. And so when I, mention, I say, well, try taking some hot showers and see if you notice a difference. And some people will report that, to, like Jordan said, the few cases that I've seen of what I would say is like real, like no doubt there's a genetic variant. This individual has a genetic variant that causes them to experience these symptoms. It's very, I think it's extremely rare, but when it happens, they don't have any desire of even thinking about doing cannabis again. It's almost like, they're like, it was such a miserable experience for them that they're not interested. They're not interested anymore.
I think that, oh, sorry, go on.
No, that was all I had to say.
I'm chuckling. Sorry about Jordan, but I was chuckling when I was in college many, many years ago. I think I was
last week
underage, and we went down to Tijuana for a weekend, and I don't think I touched tequila for 25 years. So
Yes,
it's like,
there is
won't do
something
that again. And
that
so unfortunately, sometimes good and bad, it sometimes takes an occasion like this to really go, maybe this isn't for me. And with that being said, is it for only patients taking I guess high doses of THC in an edible, smoking, dabbing? Is it something that is it something that has a higher trigger point of ingestion that usually brings that on, or is it the human itself with how their body reacts?
I've not seen a lot of data
Mm-hmm.
or other routes of administration. I mean, the classic is just smoking the weed, right? And the dabbing or vape pens or any of those sorts of extensions of that, I think fall into that category. I have no doubt that if you use edibles at a high enough dose for long enough, it'll do the same thing. I just don't think we've seen it because they're not as popular, or they haven't been as popular. They're certainly becoming more popular now.
Yeah.
And then I wanted to address something that Adam had said about the hot baths, right? I mean, one of the things that's particularly diagnostically useful is the hot baths, right? So oftentimes patients will, either through the grapevine or just on their own, figure out that while they're having this horrible nausea and vomiting, that they feel better in the shower. And that's really a diagnostic feature. So that it's reported to be about 80% of cases, we will see this sort of hot bath or shower kind of addiction. And then there's 20% that don't have it, which of course makes them much more diagnostically difficult. But if you see somebody who has the nausea, vomiting, using cannabis, and they won't come out of the shower, now you've got a reasonable diagnosis.
You brought a percentage. How many patients have a percentage of hyperemesis syndrome? Is even? I know you didn't say you spoke about. I'm not really following the data. Do you have an idea how many patients?
So what you're asking for is the incidence rate, and I think that this is sufficiently rare at this point, and also sufficiently misdiagnosed, that I don't think we have a good handle on that.
So I'm glad you said rare, because I don't want any of the doctors listening or patients listening to be afraid of cannabis and the certain cannabinoids. So can you touch up on that, either you or Adam, on the rarity of this I guess diagnosis?
Yeah. I mean, the literature, will state incidences, anywhere from maybe 3 to 8% that I think I've seen is high. And, but again, I think there's no way it's 8%.
No,
There's no way it's 3%. I find, that extremely hard to believe, given the number of patients that we have, that consume cannabis, not just to mention the fact recreationally. If you had 5 out of 100 people that were walking into a cannabis recreational dispensary and walking out consuming cannabis and having cannabis hyperemesis syndrome, it wouldn't be hard to identify the problem.
right.
I mean, we would be looking at it saying there are hundreds of people going to the emergency room every day, or, feeling sick. They're all throwing up. I mean, so I think a lot of this, like we touched on before, is a lot of hype for nothing. And I do think that, as mentioned, I think there's a few things that we should take home from this. One is that the incidence is probably even lower than is what is quoted in the literature. And we know that it's often mistaken for other diagnoses, and it's important not to miss these other diagnoses and to jump to the conclusion of that. It's important to understand treatment options for it, and when people are confronted with it, how do you treat, how do we treat these patients? And I think that's probably worth our discussion here as well. I think it's important to note that a lot of conventional, which can also potentially be a diagnostic. I don't work in the emergency room, so I'm not on that front line, but I suppose that if people were, came in with a history of cannabis, and, knowing that a lot of the classic antiemetics are not effective for it, that would potentially be a good indicator of somebody in the emergency room. We know that most of it's supportive care, hydration and time and getting out of their system. We know that the hot showers and hot baths can certainly help during that time period. And the same way that, we talk about, now I've never used this because the incidence is not high enough that I'm sitting there treating patients with cannabis hyperemesis syndrome all day, to the point where we're putting capsaicin cream on people's bodies when they have this, because that's same way hot baths help vasodilate our skin, which helps take blood flow away from the GI tract in this case, which is one of the reasons that people can feel nauseated and sick from cannabis use. Same way capsaicin, does the same thing. It causes vasodilation of our skin, and it can steal back some of the blood flow from the gut into the skin. And that's kind of the physiology behind it. But it's just important to know that, like I said, there's not great treatment options. A lot of it's, letting it run its course and helping identify that individual who has it to help them, alter their cannabis consumption or to stop cannabis consumption.
So you spoke about treatment, and just to the last sentence, you kind of spoke about prevention. And what can you share with doctors as well as the patients that are watching right now? Less is more, prevention. I mean, what would you recommend? Sorry?
It seemed, I was just agreeing with you, less is more. Yeah. I think that, whether we're using this in a medical fashion or in a recreational fashion, people talk a lot about using cannabis responsibly and sort of just taking whopping doses. And when that doesn't work because you've jacked up your tolerance, taking, extra whopping doses, it's just bound to be a problem. Like, if you drank a fifth of gin, you'd be sick unless you've had a lot of practice. And then if you drink 2/5, you'll get sick. The point is, you can take anything to an extreme. And this is one example of how extreme cannabis use can bite you in the tush. So prevention by being thoughtful and mindful about your dose, whether we're talking about this medically or just purely for fun, I think if you're way off on the limb, it really shouldn't surprise you much if you get your ass bitten.
I would never say that the concern for cannabis hyperemesis syndrome should prevent somebody from trying cannabis as an option for a medical condition.
Oh God, no.
Just because of that, and so again, it just goes back to the incidence thing. The incidence is extremely low. And it usually is in people taking higher doses, and I think with responsible use we would see even less of it.
Right. Probably than, just for comparison for our audience, remember when COVID started, right? And everybody was in a tizzy about how rampant it was and how hard, lethal it was, and we were still looking at incidence rates around 5%, right? So there's no, a 5% incident rate of something like this is a public health emergency, right? So we are nowhere near 5% or 3% with CHS. We probably at 1 in 10,000 or something like that, which is still a notable incidence rate, but it's not 5%.
So on that note, moderation, be smart, and work with a medical professional who can guide you. Cannabis is not a one-size-fits-all. Any final words?
I don't think so. I think we've covered it. Thank you, guys.
Yep. No.
Well, it's a hot topic, and I know everyone asks about this all the time, and I'm happy we touched up on it. And so, everyone, I'm John Malanca with the Association of Cannabinoid Specialists with my colleagues, Dr. Jordan Tishler, as well as Dr. Adam Abodeely. Jordan, would you like to share how others can find us?
Absolutely. Thank you. The Association of Cannabinoid Specialists can be found on the web at cannaspecialist.org. Again, that's cannaspecialist.org. And we have a whole bunch of resources for clinicians as well as patients on our website. So we look forward to your taking a look and reaching out. Thank you.
Thank you both. And we'll see you soon. Thanks for joining us. And we'll see you in the next edition of Casual Conversations.